Hello, my name is Wendy Warrington. I'm a community outreach midwife employed by the Royal Bolton Foundation Trust, and I work in the Salford area. I came to Bolton in 2012 and I was working as a community midwife. At that point I was approached by the Salford parenting team and the head of early intervention to work with Salford to create a programme for parents who were caught in the cycle of repeat removals. I have previous experience. I set up the Holding Families project, working with Early Break, the Young People's Service in Bury, and the head of Early Intervention Services was aware of the work that I'd done. So a parenting practitioner and myself devised a 7-week programme called Health in Pregnancy and Parenting, which is part of the Strengthening Families Early Intervention Service within Salford Children's Services. The programme entails a bit of health information and multi-agency working. We have a health visitor who comes in. We also have a social worker. We have just had family support worker allocated to support the families. The beauty of our programme is that we intervene early. Referrals come in from across Salford, from community midwives, from multi-agencies, from probation, from other social workers, from other trusts, and the women are less than 20 weeks gestation, which gives us a longer window of opportunity to work with these families, to be able to evidence the changes that they've made. Salford wanted this programme to go ahead because they were finding that they were having a lot of children that were being taken into care, and this was impacting on the costs and on services. The programme runs for 7 weeks, but includes group work and also one-to-one work within the family home. The programme has recently expanded. We have just taken on a family support worker to work with the fathers in the group. Fathers and supportive members of the family are welcome to attend with our clients, but we felt that we needed to expand to offer the fathers some extra support. The women that are referred to us have had children previously removed and have been affected by substance misuse, that's drugs and alcohol, mental health issues. They've had children previously removed, they've been at child protection, they've been looked after children themselves. They may still be in court proceedings with the last child, and the findings were that these women, that once services fell away, that they were left unsupported, and that's where we pick them up. We've also just taken on 2 student counsellors to help support our families, and the programme isn't just the 7 weeks. The families are kept on until the child goes to school, and that's until the age of 5, where they are supported by the family support worker. The programme has received quite a lot of publicity. We've been featured in The Guardian online. I've also done an article for Essentially Mid as one of our professional journals, and we've also been filmed for the BBC. And there is also been talks with Manchester University with Dr. Karen Broadhurst, who has done research in this field regarding repeat removals. And we're looking to get funding to have this the course researched, evaluated and evidence-based. I've recently undertaken a secondment with the early years and the early years agenda, and this has been raised at AGMA, the Association of Greater Manchester Authorities, that this actual course, the Strengthening Families Health in Pregnancy and Parenting Group, has actually had good outcomes, insofar as that we have reduced the number of children who have been taken into care. Yes, they do go home, but they'll go home on a child protection plan and a package of support, and therefore that in itself saves the authority money, In terms of health, we've had very good outcomes. We've had some good breastfeeding outcomes, reduction in smoking. We've also had the women attending for antenatal, so we've had good birth weights in the babies, and we've had only 2 that are out of the cohort, which is running around 80. Since we started in 2012, there's only 2 that have gone to special care, and that was only for the reason that there was other medical complications. So in terms of the health outcomes, we have got very, very good evidence to say that this one-to-one and group work does work for these families, and ongoing support.